Thank you.
Well, I'm here today to talk about one of our very favorite topics, obviously, by the crowd. So humor me. When I did this presentation, I actually started in square one, not really knowing who the audience was, if it included the public or not. So kind of humor me. I'm with the Association of Washington Business, the Washington Restaurant Association, and AWB work in very tight partnership. We have about 8,000 members. I do a lot of work with Bruce Beckett, thrilled that he's here. And just like the Restaurant Association, we have a very diverse group of individuals and business members that we work with. And it's always a challenge legislatively. So I'm going to make a little disclaimer right about now, and that would be that I am not an insurance broker. So for that reason, I am not going to give you insurance. I'm not going to tell you who and what to buy from, because I don't have that expertise. And I would probably lead you down a very ugly path. So I actually work with the reforms, the policy of insurance and healthcare in Washington State. But certainly I have a wealth of guides of folks who can come to your aid and give you those specifics. So anything that I can't answer that you have a question about, please come and talk to me or ask questions during the presentation. This is our actual staff. My issue area is healthcare specifically. So I live and breathe this stuff. I know you're all kind of really feeling sorry for me about now, and thank you for that sympathy, because I can use it about now. Healthcare, why should you care? As a restaurant owner, as a person of the public in the U.S., you should care. And why is because it makes a huge component of our economy. It's also one of the leading rising costs, not only as a business owner perhaps, but also as an individual. And you're seeing that on your pay stub. Obviously, I'm going to go back to history. The single biggest change that we have had in healthcare in probably 100 years was the Affordable Care Act. And whether you like it, whether you don't, it's here. And whether you agree with it or don't agree with it, it has completely altered and changed our healthcare system. So we need to look at it. We need to embrace it. We need to, whether or not you agree again or don't agree with it, we're going to keep working with it. It's very interesting to note that I want everyone to understand that on a federal level, over 54% of the dollars that the federal government is sending out of their budget is on healthcare. It's actually on Medicaid. So when we talk about Medicaid expansion in Washington State, 54% of our federal budget is coming out to the states for Medicaid. Now, you may all say, well, that doesn't really hinder me. I don't really understand. I see a little thing on my stub, or my employees see a little bit of Medicaid coming out of their check, but what difference does that make to me? Well, it's going to make a difference, because as the Medicaid system continues to morph and expand in Washington State, the costs are going to go up. The costs are going to come from somewhere. Where do you think those costs are going to come from? They're going to come from the taxpayers' pockets and the businesses' pockets, because unfortunately the federal government's not going to make more money to pay for these expenses, so it's going to come from us. There are some things that have happened since the Affordable Care Act. The uninsured rate in Washington State is the lowest it's ever been. Currently it's 7.3%. What happened with the expansion of Medicaid in Washington State is 680,000 more individuals now have health insurance in Washington State since the implementation. Again, the Medicaid is an medical assistance program, so that those are folks who aren't necessarily paying into the taxpayers' coffers. Those are taxpayers who are paying for that. There was a creation of the Washington Benefit Exchange. Within the Washington Benefit Exchange, there's a program called SHOP. That's for small businesses to be able to go on through the exchange to get insurance products. There's also outside sources. Those are association health plans. I know the Washington Restaurant Association has one. I know Association of Washington Business has one. those have been a very good tool for the smaller businesses in order to be able to get insurance. There has also been some positive things, the ability for children to remain on their parents' plan till 26, often a great thing for people who are just starting out, or millennials who are just starting out, they can't necessarily afford insurance. There has been the demise of a lot of numerous healthcare plans. How many of you out there were impacted that you had to either, your healthcare plan was changed or altered, and all of a sudden a few years ago you had to get changed up, or your business had to change? Yeah. I'm finding about 50% of the folks that I talk to about this, they had some kind of alteration that they had to make. How many of you have seen an increase in your premiums or your deductibles on your healthcare plan? Yeah, that's usually about 85% to 90% of the folks that I talk to. That's one of the things that's happening. I'm going to talk to you a little bit more about that later down the road to try to help you with that. And then there's also been a strain on the medical providers. Not so much for those of you who have a medical provider already, but certainly for that 860,000 folks who now have insurance who are looking for providers, and guess what? They're not there. We had a shortage before all this even happened. So now to be able to find a primary care doctor is harder than ever, just because we put the cart before the horse. You know, you can't say, okay, you guys, now you have insurance. That's wonderful, super duper. But guess what? There's not enough primary care docs to see you. So, and unfortunately too, Medicaid reimbursement rates for these medical providers, the hospitals, the primary care docs, even the specialists is at an all-time low. Dentists, I think dentists are saying that the dental associations say they get like 37 cents on every dollar of cost to see a Medicaid patient. That's huge. And you can't stay in business. It would be like someone coming to your restaurant and you're saying, okay, it's $15 to buy that dinner, and they're saying, well, you know, instead I'm going to only reimburse you at like $6.80. You know, you can't stay in business very long if that's the case. Again, just a reminder, this is very, very complicated subject matter, and it's very difficult. I was laughing when we were talking about this. It's very difficult for me to put up a slide and talk to you about calculations on the mandate, on calculations, on who needs to pay, the penalty amount that you pay, because everything is this very long formulary. So it's very, very difficult for me to put that on a slide. But I do want to remind everyone that if you have part-time employees, that those also have to be counted in when you're talking about full-time employees. So if you've got full-time employees and you're under that 50 mark, but you also have part-time employees, you still need to do the calculation, because depending on how many part-time employees you have, that may actually push you over the 50. So the pulse of politics. I got to tell you that healthcare, in the healthcare committee on a Washington state level, which is what I deal with. I don't deal so much on the federal stuff, but I deal with the state. We had cannabis this year. We had the temperature of noodles, because you folks know better than I, but apparently there's a different temperature that it's okay to keep noodles at before you need to toss them. But instead of that going through the Department of Health, it went through the Healthcare Committee. So now there was a bill that was actually passed, which was one of the governor's veto bills, by the way. So that bill got passed through the House, it got passed through the Senate. So folks who didn't want to necessarily have to dump the noodles because they knew that by health reasons they could stay longer, that bill got vetoed by the governor. So recently, last week. So unless he changes the 27 bills that he vetoed that one day, then that bill that was nursed for weeks and weeks is not going to be around anymore. And then there's also telemedicine. That's been a bill that we've worked for about 4 years. I know Restaurant Association supported it. I know that AWB supported it as well. It's a great way to extend our limited professionals, our medical professionals, and get them out to our rural areas, our smaller towns that maybe they need the specialty folks, but they can't necessarily get them. Or for a patient who maybe can't necessarily get from some obscure place in the state to Seattle. Because let's face it, guys, this isn't easy to get here. For any of those that drove, here today to be at this event. It isn't it isn't easy, and it's costly. And when you have an injured person or a sick person, traveling adds to the cost. Oh, go back. So in 2016 legislative session, we're still in session, so I'm still working. I worked yesterday, so we're still in session. So those of us who deal with legislative issues, I know Bruce is still working as well. So for any of us that are dealing with legislative issues, just in healthcare issue alone, we had over 100 pieces of legislation, 150 bills rather, that we had to read through, assess if it made a difference, how it impacted business, and act accordingly. So that's a lot, especially in a 60-day period. So a lot of late night reading, a lot of technical stuff that goes on, and it can be really kind of entertaining at times. We keep ourselves entertained. I wanted to talk briefly about the federal races as well. I'm not going to get into a lot of the politics of healthcare because, again, it's complicated. But I did want to give everyone just a thumbnail sketch of where people are at, and I just I picked the top candidates right now based on delegates. No opinion on my part whatsoever. But Secretary Clinton, she supports the current act. So the ACA Act is what she's supporting. She wants to expand it. She's talking about offering more through the state exchanges. She wants further expansion of Medicaid, which there isn't really a clear picture yet from her plan and reform about how that would be paid. Because again, any kind of expansion of Medicaid is still going to have to come from businesses and individuals who pay taxes. Senator Sanders, he is a single-payer data or a single-payer system proponent. So he wants government to pay for everyone's insurance or health care across the federal government. That would be paid by increasing taxes on individuals, families, and businesses. So he believes that the government should just run health care for all of us, and that's the answer. He does have a price tag on his reform of $1.4 trillion. Senator Cruz, he wants to decouple insurance from employment. There's a lot of interest in that with AWB members, where how can we as businesses look at that and say, can we just give our employees dollars so that they can go shopping for themselves and they can make the choice, instead of businesses today, they're trying to shop for the best bang for their buck that they can possibly find. And I know some of you restaurants are doing that. And it's tough. It's really tough. So what's been happening is you folks have had to probably raise your premiums to your employees, and your deductibles are higher just in order to be able to keep them engaged and keep the health care going for them. Interestingly enough, actually the mandate only impacted about 0.02% of small businesses, because already 96% of small businesses were offering health care to their employees. So that's a commitment that small business, especially as a restaurant individual or owner, you folks are committed to that. You understand that offering health insurance not only keeps your business and your employees healthier, but it's also a wonderful perk to offer your employees. And I think that's why we still see like a 96% of small businesses, restaurants in particular, keep offering these things to your employees, because you know that's what you want to do, and you want to be able for them to have that. And then also Senator Cruz, he wants to be able to offer health care across state lines, which right now is not available. So that would open up your entire marketplace. Instead of, we have very few insurers actually in Washington State based on our population. So instead of you only being able to get from the three top blue, what we call blue, because of Blue Cross and Blue Shield, Primera, Regents, Group Health, those are the top insurers in Washington State. Instead of being able just to buy from them, you could buy from any insurance plan across the U.S. And obviously that would make everyone a little bit more competitive. So that's something that Senator Cruz would like. Governor Kasich, he likes the market competition to allow choices. he really likes preventative care. So very few people, politicians right now in the presidential world, are very big on preventative care because of the cost. And yet a lot of you folks know that if you have an employee and they're a little bit sick and you say, hey, just go home and get better, then that means they're going to be gone maybe half an afternoon instead of 3 days because they kept working all day long. And then, hey, guess what? By the way, they've made all their little associates and their coworkers also sick because they've shared their germs. That's going on a lot right now. Promoting preventative care, and then he supported the expansion of Medicaid in Ohio. And only because he's a governor, I have that statistic, and the other ones aren't. Mr. Trump, he wants a full repeal of the individual mandate. He said, quote, people who want insurance will buy insurance. He wants a tax deduction for individuals who do purchase insurance, and price transparency from providers. So what that means to you folks is that if you're going to a doctor, the doctor would have to tell you how much everything costs on the front end. So you could call around to doctors' offices and saying, how much will my visit cost me? Just a general visit, and they all should tell you by that. There's a lot more conversation today about price transparency across the board. You're going to see that in 2 years ago in the state we passed a bill. It was House Bill 2572. In that bill, we worked on an all-payers claim database. That database is supposed to eventually provide you with data on hospital services, how much a hip replacement costs. So if you're going for a hip replacement, I could essentially call all the hospitals and find out how much they're going to charge me for that hip replacement. And that's how this is supposed to work. Unfortunately, I think that the way that it's being drafted and written and the rules are being made for it, it's going to take a long, long time before that information actually trickles down to the consumers. I think it will be available for those who want to purchase the study to get that information, but I think it's going to be a really long time before me, Joe Public, can actually access that information. And I think it was said before, in fact, I know it was, Anthony was saying, please be engaged in politics. And I can't say this enough. This site is, you can't see it very well, it's going to be at the end, but it's WashingtonLeg.gov. And it's a very easy site. You can go on here if you don't know who your legislators are. You just plug in your address and your zip code, and it pulls up who you need to contact. It also has their email address, which I know we're all really busy, especially you folks working in the restaurant industry. You don't have a lot of time to go down to Olympia. You don't have a lot of time to write a letter, but you do have time to do a quick email. And they need to hear from you, because you need to understand that the decisions that are going on in healthcare today in this state are being made from them. And a lot of times they don't know what's going on necessarily unless you take the time to tell them. So if one of their laws or rulings or something that's going on and all of a sudden you see the impact and you're like, holy cow, this is a huge impact to me, take the time to figure out who your legislator are if you don't already know, and send them an email to let them know. Or contact the Washington Restaurant Association if you're members of them, and let them know what your concerns are so that they can share that. That's why you're members of them. Or if you're members of AWB, contact AWB. This is a really easy way to figure out who's who so that you're not in the dark about the people to reach out and touch. These are some resources for you folks. The Washington State Exchange, which I didn't talk about, but after the Affordable Care Act was implemented, Washington State chose to create their own exchange. That's mostly to offer individual health care plans. The shop is also there. That's a small business program. That's their website. You can look there to see if you like what they have to offer as far as health care. The National Association of Health Underwriters. How many of you have time to really go into the whole health care issue and figure out who's the cheapest cost and all of that? Probably not very many of you. I know I don't want to take the time to do it. The National Health Writers are great at finding brokers. Brokers don't charge you, but they are the ones that can listen to you, hear what you're saying, hear how many employees you have, what you're looking for and such, and be able to give you options of who to do business with. So they're great to work with as far as from a business standpoint. The Office of the Insurance Commissioner, that's another one that has a lot of information for businesses, individuals, as well as folks that maybe you want to stay away from. And then the federal healthcare website has enormous amounts of resources, but just make sure you do it not late at night and when you have a lot of time, because it's going to take a lot of time to wade through it all. So what I would really like to do at this point, though, is ask you folks for your questions, because one of the reasons why I'm here today is we're committed in the next year or so to create some legislation to help our small businesses, in particular for this next 2017 legislative session. We don't hear enough from our small businesses because I can't necessarily get out to see you, just like you can't come down to see me. So I'm making the time and effort. I've got 11 stops throughout the state in the next 2 months where I'm actually going to be going to small towns and reaching out to our small business members to try to ask you to say, what are your issues? What are your challenges in healthcare today, either as an individual or as a small business owner? So are there any comments or questions?
Hey, Sheri, thank you so much for the information. Maybe sharing with everyone at this time next year when they're filling out their 2016 tax return, if their employees don't have health insurance, what is that epiphany going to be for them? How much are they going to have to owe in a federal fine for 2016, just so everyone here knows?
So I can address that again because it's actually a calculation. So it's not just a flat rate. It's actually on the number of employees, but then they take an FTE, and then there's a ceiling as well. I can tell you. Well, so for this year, in December of this year, a fine for an individual that does not have insurance is $695. And that's off your taxes. Now, interestingly enough, this is great. So the only way for you to really pay that $695 to the federal government, though, is if you're getting a rebate, because they don't have a way to really bill you yet. So that's something they're working on. But right now, if you're expecting any money back, it would be $695. And then what happens is they keep track of that. So every year that an individual doesn't pay taxes since 2014, it adds up. And then what happens is if you get, let's say you're behind because you only get $200 back as a rebate, then next year you're still going to owe $495 to them plus whatever it is in 2017. More questions? I put y'all to sleep already. That was fast, 30 minutes or less. I talk as fast as Anthony does.
So just another resource, our website has the next steps that they need to take to get insurance. So if they go to wawrestaurant.org.
So did you hear that? wawrestaurant.org?
If they go to wawrestaurant.org and they can click on, here are the next 16 steps you need to take or so, I'm making the number up, to engage. Or if I'm behind the times, I'm not doing what's legal yet.
Yeah.
And there's also an employment calculator on how to calculate your number of employees and which category you're in and the things to take under consideration. So wawrestaurant.org has got, and it's also got a Google search area that you can Google which particular area of healthcare you have questions on.
Yeah. Yet another source that I should have had up here. Sorry, Anthony. Any other questions? Great. Thank you for your time. And if you have any questions you want to come up and talk to me about, let me know.